Hi, my name is Liz Barnekoff, and I'm the 2018 First Lady for Benelli Shrine Temple of Northern California. My First Lady's project was created to support the Child Life Specialist continuing education as well as program development for the Therapeutic Recreation and Child Life Department here at Shriners Hospital for Northern California. This project is very near and dear to my heart. I've had a professional career of 37 years in child development and program development, so I'm very excited to support the Child Life Specialists.
So my name is Erica Zapata, and I live in Redding. I have 7 children, and my youngest, on Christmas Eve, we were, doing our big family Christmas, kind of thought it'd be so beautiful to turn on the gas fireplace. Matter of like a second, Sebastian, my youngest, ran up and touched the glass on there, and my daughter screamed. My 12-year-old pulled him off, and since then our life has kind of been upside down. Child Life was right there. Brought us everything that we needed. We didn't really come prepared, so they were really wonderful at providing things for all of us. And then when Sebastian had to, it's pretty traumatic for anyone with burns to have those cleaned, and as parents we're not allowed to be in the treatment room typically, so it wasn't until much later that we've been able to actually be a part of that, but initially we couldn't be involved at all. And so there was always someone from Child Life right there, there for Sebastian to kind of help him through that process, which I'm very thankful for, because it's pretty traumatic for him and for us, and so that's been wonderful.
I kind of like to see us as the middleman between the hospital and our patients and families. So we are here to help reduce anxiety in the hospital setting, whether that be through normalizing the environment through a play session in the activity area, whether it be doing education or preparation prior to a procedure, so our child knows what's going on and we talk to them at their level, kind of help interpret what the medical staff is saying to what the child's developmental level is.
And with modern healthcare, the stressors only increase, the effect on families and kids. There's not a hospital in every town, and so often kids are far from home, families are away from their other kids, and so there's just a whole myriad of stressors that can really affect kids and families negatively.
My job is specifically working with the burn population and patients who have sustained burn injuries, and just helping them cope with coping techniques so that they are able to really get through a tough experience, a painful experience sometimes, whether it's involving surgery or wound care with the burn patients, anything like that may be difficult. We're there to try to improve those challenges, reduce their anxieties, and just improve their overall experience in a not so great situation that they may be in.
Child Life and Therapeutic Recreation is in my opinion, is a complementary support through a very traumatic time, in helping get back into our everyday life and maybe learn new activities or relearn how we did an activity before, so that we can continue having a good quality of life.
I'm Leanne Wells, and my daughter Mackenzie Wells is 12 years old and has been a patient at Shriners for about 5 years for her cerebral palsy. As a parent, when your child's coming in for either a surgery or a checkup and they're nervous about it, we've done multiple surgeries and we can always count on the Child Life therapists. Everybody has that person that they vent on, and when they're mad and they're angry at the world, that person gets the front of it. With the therapist here, they come in and intervened, and it's not only helping the parent to take that place and step in and assure that you're okay, it also gives the child a different view on things.
Well, imagine a hospital stay as being so stressful for a child and the family or parents. So what the beauty of a Child Life Specialist does is they help the child adjust to the hospital environment. They work with them to express their emotion and their fears. They help to alleviate their anxiety. and they are knowledgeable in the strategies and the coping strategies, and also their developmental trajectory, so that they can bring them activities and things to do to help them along their normal growth and development. So imagine that when a child's anxiety is reduced, how that makes the parents feel. It's going to release some stress and anxiety that they feel as well. Not to mention the child life specialists educate the staff as to what the children are going through in the hospital environment.
So back when I became a child life specialist, it was just getting a 4-year degree in something like child development, psychology, and then you go through an internship. It's an unpaid internship, which I went through about a 520-hour internship. It's the hours of up to bit, and then you have to take a national certification exam to become a certified child life specialist. Since I became a child life specialist, the council is now moving towards every specialist needing to have a master's degree, and pretty soon it'll be a master's degree in child life. So the ballgame has certainly changed and got more expensive to become a child life specialist. We have a national conference once a year. There's some in California. There's some statewide conferences as well. There's different networking groups that you can get hours in, but it's typically a lot of money out of pocket for a specialist to maintain their certification, because typically it's traveling, across the country to go to a conference, so you're paying for room and board and flight and the conference.
This is my favorite part. I love the fact that the research shows that when patients are supported by the child life specialist, there's a reduction in the patient's anxiety and medication levels, as well as shortened hospital stays and more positive outcomes for them and their families.
In the last couple of weeks, I've had 2 incidents where child life has come in, and we've had a child who's been very, very anxious, where we're wondering if we need to medicate them because their anxiety is so high and it's affecting our care. And we've been able to have child life come in, and they talk to the child and they calm them down and they distract them, and they give the child tools that the child can use so that they can manage their own anxiety. And it's been really great because in both instances they were able to bring the child down, and we didn't have to use any sort of medication that could have had some negative side effect that we didn't want.
My name is Payam Sadai. I direct the Pediatric Colorectal Center here at Shriners Hospital in Northern California. Really, in a nutshell, without Child Life, we would not be able to run our program. Our Child Life practitioners, in particular Kat, is involved in our patients' care from the very first time that they walk into Shriners Hospital. They meet the families, they get a sense as to what services they may need. Most of our patients require procedures such as contrast studies and radiology, and that can be very anxiety provoking. So without our child life specialists, that process cannot happen.
So I'm Laura Van Hoetrieve, a physical therapist here at Shriners Hospital, and the part I like about working with Child Life is that we start off with the difficult times of the patients, working really closely together with Child Life and the Child Life specialist, dressing changes in the hard times, checking in. It makes our job easier when Child Life is in there, keeping the patients calm and distracted, or informing them of what's going to happen. So then when we need to do what we need to do, we work so closely hand in hand. They're calmer, they can stretch better, they can exercise easier, and then we get to watch them progress together.
So here at the hospital, I'm very fortunate to work with the whole family. So I've worked with the parents, both the parent and the patient. So I may work with outpatients a lot because we're getting back into our everyday life. So going out into the community or doing new activities, so doing sports camps or new water activities. I oftentimes in the hospital, you might find me leading a parent's self-awareness group and really going back to our 5 senses so that they're able to reconnect and be there for their child. You know, for many of them, they're away from their whole family, so they might have other children at home. So getting kind of re-in tune so that they're that much more connected connected and be able to support through that.
I work in the surgery department, and I've been up in surgery for about a year now, but working as a child life specialist here at Shriners for almost 3 years. We prepare as much as we can the day before by looking up the surgery schedule, but I can come in at 6:30 in the morning and that whole schedule will be completely different, and I have to work on the fly. But my typical day walking in is generally walking into our pre-op. And there's 4 patients, 4 first cases, and I'm assessing the moment I walk in to see where the highest needs are. That's my goal as a child life specialist in that surgery department, is meeting every patient that comes through, whether it be an inpatient admission, a same-day surgery. I try to meet every single patient and family and assess their needs.
Having a recreation therapist and being part of Northern California is an honor, and I'm very grateful for it. To be a recreation therapist, you have your 600 hours of internship that you complete and then sit for a state and national test. Throughout the year, you are required to get CEU units, and also remembering that the more we fill our tools as recreation therapists, the more that we can provide. So I've been very fortunate to be supported.
The therapeutic recreation child life specialist can actually help move the child along to what needs to be accomplished, and the nurse can be evaluating how the child is responding, and they can work as a team to make that happen. And I think that that's a powerful statement about care in general. Decisions here at Shriners Hospitals for Children in Northern California are made by physicians, but as part of their teams, you've got people who are ensuring that those courses for care are actually achieving the end results. So,
the beauty of Shriners is that they understand that children shouldn't be pulled out and treated as an individual entity, but they are in a family system. So in order for them to make the most gains in their recovery, the whole family should be supported through this procedure in the hospital stay.
I can't say enough for the department, because honestly it has made a world of difference in our comfort here, in our ability to cope with being here, in helping with any questions that we have had along the way, just in helping to kind of keep things a little normalized for us too. It's life altering, and you really don't ever expect something like this to happen, and it's just, everyone is so kind and has just been wonderful, and it's made all the difference in our stay here.
We all know in the business world how important it is that these people are trained in their craft and that we're bringing them current information. Research today is happening at such a fast rate, and we're gleaning all of those wonderful results from that research, but we want to put them into practice in a hospital setting. So continued education is extremely important. Also, Shriners prides themselves on being a teaching hospital. So generating enough funds, which I'm hoping we will do, we have the opportunity to develop a practicum as well as an internship in the department, so now Child Life becomes a teaching department as well. Well, I have some jewelry, shrine jewelry, that can be purchased in support of my project, as well as outright gifts that can be earmarked for this project at the hospital. So I think it's extremely important that everybody realizes just how wonderful the child life specialists are, and that they are very needed in this hospital. I hear from doctors and nurses countless interviews how they don't know what they would do without them. I know I'm hearing the same thing from parents. That sense of calm that a parent has when their child is so cared for and their anxiety is reduced is miraculous for the whole family. So I'm hoping everyone supports my project so we can continue to make a difference in this department.